So you work with the doctors and their case presenters on treatment acceptance.
Absolutely. And sometimes that case presenter is the doctor himself or herself. And if there's someone else in the practice, I work with them as well. Because this is the heart of how productive a practice can be. Until the patient says yes, you don't have the opportunity to perform that service. So this is oftentimes where people bring who they are to the table. And what I mean by that is if a doctor's feeling like I'm not real comfortable with my fees, or this patient just told me that they've got 2 kids in college and the engine blew up on their car, how am I going to say to this person, you need $12,000 worth of dentistry? And the other element that can oftentimes hold doctors back in successful treatment presentation and acceptance is you mentioned that they're science people. They absolutely are. They have great training and experience. And oftentimes when a person's uncomfortable, they'll go to their safe place. And so for so many doctors, it's information, it's clinical information. And one of the biggest traps, if you will, if the patient doesn't seem like they're connecting or they're excited about this, is to then go into what I call information overload. So if a little information is good, a lot must be better. And that's not the case, because I have watched, when I'm on site in practices and done evaluations, I have literally watched a patient's eyes, glaze over, where they're thinking, I'm totally lost.
The doctor is giving a very boring presentation.
For the patient, boring. If you're another dental professional, fascinating. But unless you're treating all dental professionals, it's going to be an issue.
All right, so you work with them on their numbers.
Yes.
Do they oftentimes don't even know their closing ratio numbers?
Many, many times. Or, the thought is, well, I just met with Mrs. Jones this morning. She seems so excited. And at the end of the day, you find out Mrs. Jones left without scheduling an appointment. She didn't even want to talk about the financial aspect. That's not an accepted
And usually
patient.
the doctor's maybe at home a week later going, what happened to that lady? It was so nice.
Right. Or they'll come, 2-3 weeks later, what happened to Mrs. Jones? Oh, she wasn't going to accept treatment. So it's yes, yes, yes when they're in front of the doctor, but yes might be, let me out of here, because you've shared a lot of information. Obviously you know what you're doing, but I don't feel how that will benefit me. Okay. And that's a big part of it. How will this treatment that you're recommending personally benefit me?
Where should somebody be on their case presentation closing ratio?
Great question. You can, and where you want to be for things to run smoothly and have a very successful practice would be in that 80 to 90% range. And I'll tell you, the majority of doctors, when I start working with them, are anywhere from 42 to 65%. Now, some doctors say, again, back to how numbers can be frightening, overwhelming, scary, judgmental, they'll say, my goodness, I'm at 44%, that's horrible. And I say, doctor, all I see here is tremendous potential. And it's my job to tap into that potential, because can you imagine the impact of taking a practice from 44% treatment acceptance up to 82? I can, because I do it over and over again.
It's a double in practice.
It is.
Double in money.
It's phenomenal. And that's where things start to become fun. And that's where I have doctors say, in fact, one doctor, he was 24 years into practice, and you could just see the weight of it on him. He was tired. We worked on this, and on my 5th visit, this was about 7 months into our consulting with him, at the end of the day, he said to me, I want you to know, and I could see it all day in him, but it was great to hear the words. He said, I want you to know, I have started enjoying dentistry like when I first did. And that to him was worth everything. The money was terrific, of course, but and I could see that he was revitalized.